Hi, welcome. I am really happy to be here today. I am with Maeka Wright, who is a person of many skills. And today we're going to be talking about the pelvic floor. Maeka is a manual osteopath, a PTA, but most importantly, a yoga therapist and a graduate Think Deeply Yoga Therapy program. So thanks for being here, Maeka. Nice to see you.
Thanks for having me.
I wanted to talk to you because I know working with the pelvic floor is one of your interests, and you did a course for us on our Breathing Deeply Wellness platform. I thought we could have a little discussion today, helping people sort of figure out why they would want to do yoga therapy for the pelvic floor, for what conditions, that kind of thing. So maybe we should start talking about what kinds of people, conditions, scenarios you would want to seek out or do our online course or seek out a yoga therapist for.
The course that I designed and the work we can do as yoga therapists can be more broad than what you might see somewhere else, where they tell you like you have a weak pelvic floor or you have a tight pelvic floor. We're sort of starting from the place of awareness. So it's sort of like hits a bunch of different conditions in one, where you might have a weak pelvic floor. You might be weak and tight at the same time. And you might have conditions like incontinence, sexual dysfunction, pain, sort of like this big ball of things that can happen. But also thinking about the yoga side of things and just feelings of stability coming from that root area of our bodies and how that intertwine the physical, the emotional, the mental side of everything, where in other modalities, you might get only physical or only thinking about it as a chakra. And we're sort of able to find a balance between both sides of that, which I think is super helpful.
Yeah. And I've noticed, I've also worked with a lot of pelvic floor dysfunction. And for some people, it's just like, oh, I have this problem, it hurts, or I have a urinary issue.
Yeah.
But for a lot of people, other things come along with it. Often people have other pathologies that stem from pelvic floor weakness or tightness. It could be physical pathologies. And then there's also a lot of emotional stuff that could be attached to it. Some of it's the condition itself, but some of it's just the way it affects us when we have pelvic floor dysfunction.
Even just the simple fact of being diagnosed and being told that you have this condition, that maybe you feel broken or there's something wrong with you. And we're not really approaching it in that way. We're approaching it more in building an awareness, getting more comfortable with your pelvic floor and starting there, rather than being like, you have this problem, it's broken, let's fix it. Because I really believe that with the tools of yoga therapy, the body can find its own healing process, and that exercises and things we put in place are to support each person in finding their way to health.
Yeah, and that's true with a lot of yoga therapy, the way we work, where I think of it a little bit as threading the needle, right? Like we're prescriptive, like we'll definitely tell you how to strengthen or lengthen your pelvic floor muscles. That's a problem for a yoga therapist. We know how to do that. But that's harder to do when you don't have a good sense of it or a sense of your breath and how it affects your pelvic floor. And there's many other examples. We'll often start finding ways to help you find your pelvic floor, notice where your pelvis is in space.
Floor. What is it even doing?
Yeah,
maybe I have no idea. So it's saying we need to strengthen the pelvic floor. And I feel like there's a step before that. How can I learn to even feel or notice where it is and what it's doing?
Right.
And affected by breath, affected by posture, affected by stress. But how do we sort of figure out?
And, you know, I've worked with you a bunch. One place that we worked together is when you were a student and in our practicum and you're working with me. So I've seen how you work, which is why I was super happy you did this course, because the super special thing about yoga therapy is it's very individual. I'm guessing a lot of people that are listening to this probably have a pelvic floor issue. Most people don't seek out pelvic floor therapies that don't. They might have even gone to other people. It's very likely. Pelvic floor specialist, a PT, the doctor might have said something, and probably, maybe not everyone, but a lot of people listening to this might have not had the success they wanted, whatever that was, right? The result they wanted.
Maybe they got some progress and they feel a little better, but they're still like, feel like something's missing. Like, what else can I do on my own to sort of get further?
Maybe you could give us a few examples, because I think, if I go online and search pelvic floor therapies, you basically get, what do you get? You get Kegel
You
exercises.
get Kegels.
You might get a couple stretches. You don't really get much. It's kind of all the same. And then I've also seen yoga things that are a little excessive. Like they're kind of like, let's find and work with our pelvic floor. And it's like an hour long, exploration, which is great if you have the time and inclination. But I'm guessing most people maybe don't want to spend hours investigating their pelvic floor. So
I'm really into practices that are effective and simple. We don't want a big, long practice. Most people don't. And we don't want something that's super complicated with lots of pieces to pick up and figure out. And I just think the sweet spot is when it's easy, but it works. So that's always what I'm searching for when I'm thinking about tools and ways to help people with their pelvic floor.
And I've noticed, particularly watching you work, that you have a kind of nice way of like getting people to find awarenesses and to do strength work and stretching work that's more intuitive and easier than I think like PT. And I say that the PT because you are a PTA and I know you've worked for years, and I know you're also an osteopath. You definitely have put in your time with clients in a variety of ways. So you've arrived here for a reason. You clearly think this is a good idea. To probably what you were doing 15 years ago or 10 years ago.
Just to sort of show the contrast between maybe like a PT approach and a yoga therapy approach, or the way I teach it, is I have a really good example of someone I was working with last week. And I was asking them to lift one leg at a time while they were lying on their back. And because they had been to a physical therapist before, they started it and then they were like, wait, am I supposed to move my hips? Am I supposed to be holding this in a certain way? And it took me a minute to realize that they had this physical therapy framework for me to say, no, I just want you to notice. So I'm not asking you to change something specifically in this moment. What I'm asking for you is to just do this leg lifting and turn your awareness to notice what's that doing to your pelvic floor.
And what's the benefit of noticing? Because I'm imagining someone listening to this be like, well, how's that going to help me with my urinary incontinence, my sexual dysfunction, my pain? Like, why would I want to be more aware of this thing that's causing me problems?
Right. I just think then if we're trying to strengthen an area that we can't even feel or notice where it is, that can be a real challenge. And the pelvic floor is really part of the whole core, the whole piece of the core of the body. We want to have an awareness of what's happening in our pelvic floor so that we can learn how to strengthen that whole piece and how it affects our breathing. And if we don't have an awareness, just hearing someone say, when you inhale, your diaphragm comes down and your pelvic floor comes down, doesn't register unless you've had the chance to notice what that feels like.
I mean, once people have greater awareness, we kind of get into the simplest exercises that are going to get the job done. Whatever that job is. It's usually not as complicated as people think it is. It feels complicated because the symptoms are so upsetting. You think to oneself, I need a giant intervention to fix these symptoms.
Yeah, right.
Because it's a giant problem for me. It's really not the case, is my experience. Is that yours?
No, usually there's that one moment where the light bulb goes off and they're like, oh, I can feel my pelvic floor. And then once you get that spot, the rest is just building on that.
I feel like the one thing we haven't touched upon that's important when you think about yoga therapy versus other techniques is also the way we think about the pelvic floor not in isolation. Yes. And you mentioned the core, but it affects everything and everything affects it. So the way we hold ourselves, where we're placing our feet, the way we engage other muscles or have weak muscles, like if you don't have any glute strength or hip flexor strength, your pelvic floor is probably not going to end up super happy. I mean, hopefully it will, but chances are something's going to go down. Right. Yeah. So one of the things we're good at is looking at the whole chain. That's part of our training.
Instead of like me interacting and saying, you need to stand this way, move this over here, and fix your posture. If we approach it from a way of, oh, I notice that I'm always gripping my abdominals, then you make the change. It just works better. It's like,
then your brain can make the change, right? Your brain's like, oh, there's some in my abdominal muscles all the time. I wonder what would happen if there wasn't.
Right. And that's that whole awareness piece that needs to come along with this process.
I've seen some kind of miraculous things with people on pelvic floors. Do you have one example of something someone did that doesn't have to be miraculous, but where they got better?
Yeah. I've seen people who are like the one that I saw last week. She's in her 80s. She's like 86 years old and has been dealing with this for a long period of time. She's super active, always hiking out in the woods and stuff. But then this became a bigger and bigger problem where she just had so bad incontinence that she felt like she was losing out on her favorite part of her day, which is walking in the woods. Just that light bulb moment of having her sit on a chair, take some breaths, take some time, notice what's happening with their pelvic floor. She'd never been able to make that connection with her mind before. So once she was able to notice that her pelvic floor was not moving when she was breathing, and then learning how to let it move with the breath, that translated into allowing it to move while she was walking. So then we're thinking about a muscle that's then able to respond to the pressure that's being put onto it instead of just always being like, while you're trying to walk. And then it wasn't an issue anymore. She still has to be aware of making sure that she empties before she goes for her walk and stuff like that, but it's not keeping her in the house anymore.
So glad we're doing this because I really want people to understand that these problems are solvable. And it's not something that was necessarily a lifelong. And if you've been living with pelvic floor dysfunction for any extended amount of time, like anything that happens to us, we kind of get used to it. And we start to think that that's normal and that it are normal. It really doesn't have to be. I'd really encourage, if you're having any issues at all, you can find Maeka. You can find Maeka's course at breathingdeeply.com. You could start there with the pelvic floor course. If you needed extra help, you can have private sessions with Maeka as well. That would give you a nice feel for the kinds of exercises the course for sure kind of get you going. And I really want to thank you for having this talk with me and doing this course. I hope you help hundreds or thousands of people with their pelvic floors.
Yeah.